Bismillahirrahmanirrahim. Today we will talk about the different type of anticoagulant agents which are used and different type of hematological disorders. So those drugs which are used in the treatment of hematological disorder. Before starting the lecture, I am going to differentiate between heparins and warfarins, which are, you can say, how we can differentiate between heparins and warfarin anticoagulants. So this is the main difference. The first one is heparin is naturally occurring anticoagulant. Animal, it can be extracted from the animal source, from the lungs of the ox and the intestine of the pig, while warfarin is synthetic anticoagulant. Heparin, they are always present in active. They are active on views and in vitro. You mean in body and vitro. So you can say heparin is active on view and in vitro, while warfarin, they are active only in view, only in your body, because this is synthetic source. Heparin can be administered parenterally, IV, intravenously and subcutaneously, while the warfarin can be administered orally, IV and rectal routes also. Heparin, they act by activating the anti-thrombin 3 and inactivate these factors, factor 5, factor 2A and factor 4A and factor 6 and factor 7A and factor 8. And while the warfarin, it inhibits the vitamin K dependent clotting factor 2, clotting factor 7 and clotting factor 10. Heparin has a rapid onset but short duration of action, while the warfarin has a delay onset but long duration of action. Another difference between warfarin and heparins. So there are different type of anticoagulant. They are used like EDTA, ethylene diamine tetracetic acid. Heparin therapy is monitored by measuring a PTT, that is called partial thromboplastin time, while warfarin therapy is monitored by measuring prothrombin time and international normalized ratio. In case of heparin, if let's suppose overdosing, let's suppose if heparin they are overdose, so overdosing is treated with protamine sulfate antagonist, while in case of overdosing of warfarin, it is treated with fresh frozen plasma, FFPS, fresh frozen plasma, or vitamin K antagonist. Heparin, it doesn't cross the placental barriers, so that's why heparin, that is safe in pregnancy, while warfarin, it can cross the placental barrier and it has some teratogenic potentials. Teratogenics potential means abnormal, there may be chances of abnormalities, mean it cannot be recommended in pregnancy. Actually this is synthetic source, while heparin is natural source. Heparin is used mainly to initiate the anticoagulant therapy, while warfarin, so it is used for the maintenance therapy. The heparin is expensive, while the warfarin is non-expensive. Now I am going toward the different type of drugs which are used and the drugs affecting the hematological systems. These are the objectives which I am going to cover. By completion of this section, the learner will be able to describe the uses and effects of drug affecting hematological system, describe the classification of drugs used in hematological disorders, discuss the action of hematological drugs on the body, and identify the expected and adverse reaction of the drugs affecting hematology system, and discuss the nursing responsibility related to the drugs affecting hematology hematology system and calculate the dose, drug dosage accurately. First of all, we will define coagulants. What are coagulants? So, coagulants are those drugs which promote coagulations. Coagulants are those agents or those drugs which promote coagulation. What are anticoagulant drugs? So, anticoagulant drugs, basically those drugs which prevent the blood from clottings. Now come to our homeostasis. What is hemostasis? Hemostasis can be defined as it is the prevention and stoppage of blood loss from an injured blood vessel. It's called hemostasis. Hemostasis, the process which is involved in there will be the formation of platelet plug. As a result of there will be activation of the clotting factor and growth of fibrin meshwork into the blood clotting, making it more stable. This is hemostasis. And look at here, these are platelets which are smaller than RBC, and these are red blood cells which are also called erythrocytes, and these are also called, you can say, these are the broken blood vessel walls. Look at here, these are the broken blood vessels walls, and these are activated platelets. Here is a clot formations which is occurred in the blood, and here this is fibrins. Look at here, in this diagram you can see here blood clot formations. These are red blood cells, and these are fibrin clots, you can say, and these are platelets, as these are the white which here it is seen. This is these are platelets, and the clotting factors they are present here. Now, hemostatic agents. Hemostatic agents are those agents so they can arrest the bleeding either by vasoconstriction or by promoting coagulation of blood. Now, I am going to categorize the hemostatic agents. So, it can be classified into different categories. Hemostatic agent, one is local agent and the second one is systemic agents. So, local agents, these are the local agents. So, it may be in the form of astringents, adrenaline, thrombin, fibrin, gelatin, calcium alginates, and oxidized cellulose, and haemocoagulase. So, these are the local agents, you can say, steptics. The second one is systemic agents. So, systemic agents in the form of vitamin K, fibrinogens, and anti-hemophilic factor, and as well as you can say adrenochromes, monosemicarbazones, and ethanoxylate and desmopressin. So, these are different type of agents, you can say, which is used in the treatment of hematological disorders. Look at here, these are local hemostatics, which are also called steptics. So, local hemostatics are those drugs which are commonly used to control the bleeding from the capillaries and the blood vessels. For example, bleeding from during tooth extractions, abrasions, or epistaxis. You know, epistaxis mean bleeding from nose. This is called astringents. So, astringents basically they precipitate the proteins locally in the bleeding site and control the capillary oozing. The capillary oozing, for example, solution of ferric chloride and tannic acid. So, these are astringents. Now, what is adrenaline? So, adrenaline, it causes vasoconstrictions alpha 1 when applied locally. So, adrenaline is actually, these are emergency hormones. White adrenaline, they are also available in the form of injections. So, after administration, it causes vasoconstrictions alpha 1 when applied locally. A cotton pad soaked in 0.1% adrenaline solutions is used to control the capillary oozing. So, how it can be controlled? For example, let's suppose in case of epistaxis, bleeding after tooth extractions, or you can say from the other side, so it should be avoided in the patient suffering from cardiomyopathy cardiovascular diseases. Let's suppose if the patient who is suffering from cardiovascular disorder, cardiovascular disease, for example, let's suppose cardiovascular disease in the form of hypertension, arrhythmia or angina pectoris and other ischemic heart disease, so it may precipitate the MI myocardial infarction or aggravate the existing condition. The third one is thrombin. Now, what is thrombin? Thrombin pharmacologically, so thrombin, it is used topically. Thrombin can be used topically to control the bleeding from the capillaries. It can cause hypersensitivity reaction and it shouldn't be injected, because thrombin, they are used topically to control bleeding from capillary. The fourth one is fibrin. So now what is fibrin? Fibrin, it consists of fibrinogen. So all these are proteinaceous in nature. These are proteins, you can say. So factor number, so this should be written in Roman digits, like you can say this is 13s, factor 13. Thrombin, calcium and other clotting components. So it is used to control bleeding during surgical procedure or surgical prophylaxis or the spray on the bleeding surface. The fifth one is gelatin. So gelatin is an absorbable haemostatic and is available as a spongy or a film, so it produces haemostasis by providing a physical meshwork on which the clotting can occur. So these are the adverse effects which are reported. So adverse effects, they are in the form of infections and fibrosis. Calcium alginate. Calcium alginates, it is obtained from the seaweeds. And calcium alginates, it is an absorbable hemostatic and it is used to promote wound healing. So they have the capability and tendency to promote the wound healings. The seventh one is oxidized cellulose. So oxidized cellulose is by nature, so it is an absorbable hemostatic and it should be applied dry so that it swell up and help in the formation of clot. It is used to control the bleeding from capillaries and arterioles where the ligation is not possible. Simple, these are absorbable hemostatics, and it may cause tissue necrosis and maybe in the form of narrow damage, and vascular stenosis may be occur. Hemocoagulase. Hemocoagulase is enzymes complex which is isolated from the venom of Bothrops atraxo-vipers. So as we know that there are certain there are certain drugs like you can say chemotherapeutic agents which is used against cancers. So as we know that most of the drugs, especially those drugs which are used in the treatment of cancer, so it can be extracted from different type of poisonous snakes, from the venom in the form of toxin, and then initial or target is that we are going to treat these cancerous cells with the help of drugs that is called, you can say, chemotherapy. Let's suppose if your chemotherapy it is failed, then after that the patient we can apply different type of radiation therapy, bombardment rays. So if your radiotherapy, if it become fail, so the third choice, that is vaccination. So then we can prepare different type of vaccinations from these animals, and then it can be injected to the patient to destroy these neoplastic cells. So here is the case. So basically hemocoagulase enzymes, it is a complex which is isolated from the venom of Bothrops atraxo-viper. These are the type of, you can say, poisonous snakes venom. These are the toxin. So it has powerful hemostatic effect, and it promote the coagulation by converting fibrinogen to fibrin, while it can also shorten the bleeding and clotting time, thereby reducing the blood loss. And it is also available for topical, intravenous, intramuscular and subcutaneous administrations. These are the different agents which are used locally. Inshallah, in next lectures I will discuss about the systemic coagulants, that how it can be used and what are the different drugs which are used in the treatment of hematological disorder.